a year before I got diagnosed with breast cancer, I wanted to do areola restoration. So that's what I do. I do 3D paramedical nipple tattooing. Creators
Why?
like
Why did you want to
you.
do it? Were you,
I was a makeup artist for 19 years and an instructor. So I just wanted to pivot and I wanted to work and give back. If you can come to fly to my city, Calgary, Casey and I, the Nipple Sisters, will create nipples for you.
Oh my God, are you for real?
Yeah, we'll create
Let me see those.
So these are just the cart with their hand drawn, but these are the bridge. So they're called the notorious NIPs. Dude, read this article, this guy named Vinny in rural America that did it. I'm like, I want to do that. And then I got breast cancer.
Hi, everyone. Welcome to the podcast. For many of you who watch this podcast, listen to this podcast, or who know me from other worlds, you probably are very well aware that my best friend Brooke, who I actually had on this podcast a couple months ago, has been battling breast cancer. After a double mastectomy, what I didn't realize was not only the physicality and the physical obstacles that one goes through in trying to heal, but emotionally and spiritually, what a woman has to endure on this journey has really opened my eyes. So today, in continuing with this thread, I have on a breast cancer survivor herself, Carmelina Baccari. But Carmelina did something different. Once she got through her journey with breast cancer, she wanted to heal and help other women. And what does she do? She is a tattoo artist that primarily helps with reconstruction of the breasts after they've had the new implants. So she's a tattoo artist, an areola artist, so she puts the nipple back on, essentially. So today we're going to talk to her about her journey, and Brooke also will join us for the last 15 minutes of this podcast so that the two of them can talk about what is coming up for Brooke and how she might be able to help. So ladies and gentlemen, Carmelina Baccari. I'm so happy that you joined me. As you probably know, one of my best friends is battling through breast cancer at the moment, and she's only halfway there. So it's been an incredible journey for me to, I've known people with breast cancer, but I've never been as close to someone and kind of going through it with her. And so it's really opened my eyes to, how devastating this disease can be, and how all encompassing it is. So I know you have also been down that road and have had breast cancer. So tell us about what your life was like before and how you found out that you had breast cancer.
Okay, so I'll start off with breast cancer. This will be, everybody gets kind of like, whoa, did she really say that? But it was a gift because I was already on a path of healing some obviously we all have them, inner childhood wounds, but that was kind of like my big one. Like I was forced to look at myself deeper, although I thought I was in the mirror because everything was stripped from me. I was diagnosed, it's literally 10 years has passed. I got my 10-year is over with, where I was supposed to be on medication for 10 years. I chose a different route. My journey, I don't push it on anybody else. I was supposed to be on tamoxifen, which is a estrogen blocker, but I chose to do a lot of alternative stuff, a lot of things. I just felt that was my journey, and I followed that from my intuition. My life before, as I was saying, was on a path of a lot of inner looking at myself in the mirror, of just wanting more and being better for me. A lot has changed in the 10 years, a lot of good changes, a lot of pain and darkness that has led me to the light. We all have that.
Yeah.
We can ignore it, or we can be forced to get to the light by going through the darkness. So I got diagnosed, had my first chemotherapy on my birthday, my first chemotherapy at 8 a.m. December 12th. 10 years ago.
So was life just going along for you? Like things were just normal, you were just living a normal life, and just go to back just a bit further, because a lot of women want to know how you find the lump, or
Yes.
how do you
So for
discover it?
exactly. So I grew up in Italy, part of my childhood. My father was from there. My mom's Canadian. So I go on a yearly trip to Italy, and I was on a trip there, visiting my best friend, one of my really close friends. And I was there, and under my left arm, it wasn't a lump that I could feel in my breast, but there was a lump in my breast, but it wasn't, you couldn't feel it or see it. It was by my nipple. It actually moved from my breast to my lymph nodes. And I'll talk a lot about this in this podcast. If I didn't listen to my body and wasn't aware, it could have spread, and it could have been um, mortality.
Yeah.
It was in my lymph nodes. So I felt a pulse under my arm. It didn't hurt me. It wasn't a lot, but I felt it and was like, that's weird. And I even said out loud to my friend Tony, I said, I hope it's not breast cancer, not even knowing the connection that it had moved from my breast to my lymph nodes. So that's how.
Right. So you felt it under your arm, and
Yeah.
was it a large lump, a small lump? How?
No, it was just my lymph nodes just like pulsating. It wasn't even a lump, just like telling me something was wrong. So I went to the doctors when I came back from my trip. My family doctor said, oh, don't worry, our lymph nodes swell, when we're sick, don't worry. But intuitively, I felt like something was not right. I didn't
Mhm.
feel any different. I just felt intuitively. And if you listen, your body does talk to you. You have to really listen. And I said, can I get an ultrasound or like a mammogram? Even though I'm kind of against the mammogram thing, I did get one and an ultrasound. I did a tomography as well,
Right.
more of a heated infrared light. I believe in science and alternative. I just go with my feeling. I don't of what I need for my body, but I'm open to a lot of things. But I did the mammogram and ultrasound. I was waiting in the room for a while. I'm like, something's wrong. The doctor comes in. They don't usually do this. And he said that day, I see cancer. Very shocking. I walked to my car, actually messaged my sister Gina saying something, I think something's up because they were taking a while. I just felt it when the ultrasound girl was going over and taking a while. And I don't remember getting to my car. I got into my car. I literally, from that day on, I was floating. Like I wasn't really, it was surreal. I wasn't really in present mode, but then I became very present. Cancer brought me presence, um, where I became very present in my life, whereas before I wasn't. So
Right.
that's what changed, Mary. I became very present to little things, which time to time I forget, but I'm coming back to that.
So you got diagnosed. What stage would it have been?
Stage 3.
Stage 3.
Mm-hmm.
So that meant you had
An
what
aggressive
were
set.
so oh, you had the aggressive. So was it hormone positive?
Yes, it was ER positive and PR, and it was a triple. It was a triple, not HER2, but ER estrogen positive. So that's why they said, okay, we want you on tamoxifen for 10 years. I knew the day where they told me all my treatment plan that I didn't want to take that. I never said it out loud, but I said it to myself. So I do a bunch of other things. For me, I don't drink. I wasn't a big drinker, but I don't drink alcohol because it raises hormone levels. I do a bunch of my own things, the ozone therapy weekly, eat clean. I'm a flexitarian. I did do vegetarian for a while. I'm very balanced, but number one is how I process my emotion in my life. Because I feel I got breast cancer. This is how my feeling. I feel like it was how I handled emotions, chaotic relationship, just not processing my emotions, cortisol levels rising up and down, fight or flight mode all the time.
That's I'd love to like bite into that, because I feel like stress and plays such a role. And they've always said that. You've heard many times people say stress levels can cause all kinds of problems in your body. I kind of used to blow that off, but I totally believe that to be so true. and the cortisol levels go up. Like for instance, I have three sons, but one of my sons is a chronic worrier. Like it's very debilitating for him. So and he ended up getting alopecia areata, and lost all of his hair. And it's an autoimmune, but I often wonder if that autoimmune was flared by the constant pressure, stress, worry that he put on himself. And so all the time I'm trying to, now that its hair's come back, and he's on therapy for that,
Mhm.
a new medication, I'm always like, calm down, calm down, calm down, because you realize, and I'm one of those people who I wear my emotions on my sleeves. Like I'm very open to, like,
So do I.
yeah.
Yeah.
And so I think what you're saying, there's so much validity to it. And if we slow down and um, not overreact all the time to things and let our bodies catch up with our emotions, I think that's what happens. We don't. And our
Yeah.
bodies start to freak out, right?
And disease happens, like dis-ease. I feel intuitively, and what you're saying about your son, I truly believe. Like I used to be a major worrier when I was younger, and I feel it was how I process my emotions, or suppressing, or not being able to express, or not respecting or having boundaries for myself, or love for
Mhm.
myself, no emotional availability, accepting that it can, it can create a lot of toxicity in the body. But I do hear what your friend Brooke said. I hear it from a lot of breast cancer patients. Like I'll get people, can my friend call you? Can my aunt call you? The
Yeah.
first thing I say is, what unhealed wounds do you have, or things that you have to heal before you get through this? And then there's a lot of people that's like, oh my God, da da da, this happened. I always say that first.
So
Yeah.
when you found out you were diagnosed, then they had you go through chemo prior to getting you had a double mastectomy.
No,
No?
so so I had chemo first because my cell was aggressive. They didn't want to do surgery and cut into me. So
Oh, right.
we need to shrink your tumor and the microscopic cells, because it had gone through to my lymph nodes, which is dangerous. And I didn't know that at the time. I kind of was,
Right.
let's just get through this. So that's why they did it, because my lymph nodes is dangerous going through the body. It's like a gateway to other parts of
Of course. Yeah.
metastasis. Then surgery. He did want to do mastectomy, my oncologist, but I didn't want to, because I would have to have expanders for 6 months, and then surgery, and then again, I'm like, I just don't, can we do something else? Like I just don't want to go through another 6 months of this. He goes, what are my options? He's like, okay, I really suggest that, Carmelina, but you could do a lumpectomy, and then you take my sentinel nodes. He took 15 lymph nodes out of my left arm here. Then he also said, did you want us to take one breast off if we see more, and take the other one? Like, and I was like, it was just like I had to decide in those before
Yeah. Yeah.
going in.
Yeah.
I'm like, yeah. But if I knew, would have known before, I would have said, just take them both off. Do you know what I mean? But
Right. Right.
anyways, he didn't have to take my breast off. He took more. They always take more. They'll take the tumor and more, because they
Right.
don't want to leave anything behind. So I didn't get an unilateral, thank God. But if I would have known, I would have said, take it off. But he did want to do a mastectomy. I just chose that. I was just done after chemotherapies. Chemotherapies, it's crazy.
That's something I think is really interesting that people don't recognize when someone gets a mastectomy or even a lumpectomy, a partial mastectomy. They don't realize that, and I guess I didn't really think too much about it, but I knew about it, that
Yeah.
oftentimes the nipple has to come off. When you have breast cancer, I think there's a misnomer that just the tissue has to come out, and that you basically look like a boy, but
Yeah.
but the truth is that they oftentimes have to take the entire areola, the nipple, everything off.
Everything out. Yeah.
Yeah.
Sometimes they can do a surgery. Because of the work I do, some women have had I've done areola restoration, pigmentation on cancer patients that have their nipples. They got to do a whole reconstruction with their nipples still there, but sometimes they can die off or flatten out.
And
But
so
it's
that,
very
Carmelina,
rare to keep that though. It's very rare because the doctor wants to take it all off for safety.
because a lot of times, isn't it the milk ducts themselves
Yeah,
that end up with the cancer as well? So
exactly.
they, yeah.
Exactly. The ducts are exactly what it is. So women, they can create a nipple. Sometimes it works, sometimes it doesn't. Is Brooke doing she's doing the expanders? Okay.
She's got the expanders in. So,
Yes.
so just to kind of recap what you were saying, so you went through all of this cancer treatment. You ended up not getting a mastectomy.
Yeah.
Then you had that you had the lumpectomy. You had the lymph nodes removed, and then you went through chemo, radiation, and you did not go on
Tamoxifen.
the tamoxifen. So what happened then? So I'm sure the doctor wanted you to go on it.
Oh, yes. Yeah, they wanted me to. I said I was trying to get pregnant, which I wasn't. I just didn't want the pressure. I just knew I didn't want that medication. Intuitively, I just felt I didn't want it. So I did a bunch of things like no sugar in my body, stress levels low. I kept I meditated. I never
Yeah.
meditated before. Um, Changed a bunch of things in my life. Foods, the alcohol, as I mentioned, but the big one is stress levels, my hormones, cortisol levels. And then I took supplements daily, and I still do, like broccoli extract. Some doctors don't agree with it, but I just followed my heart, my intuition.
But I'm just like, how brave are you to have gone through this despite doing going the opposite direction of what your
Yeah,
doctors were telling you to do? Because that in itself is, I mean, that must be scary because they're telling you to do one thing and you're
yeah.
intuitively thinking, no, I don't want to do that. I mean, that takes a lot of courage.
Thank you. Yeah, it was super scary, but I just kind of compartmentalized and didn't let that affect me. Because I was so strong with my feeling, but I'm open to um, Western medicine. But I just knew in my soul that I don't want to take that. I don't want to block the estrogen. So I did a bunch of other things. I had a one-on-one with this breast cancer advocate in New York. Her name is Eileen Jacobs. She doesn't tell you what to do. She's very, and I don't tell anyone what to do. She's just very informed. So before I went on my journey, I'm like, I'm gonna have a one-on-one. And then I just followed my gut, like completely. I'm like, this is what I want to do. I was even afraid to do chemo, but it was so fast. But I knew intuitively I had to do
You know,
chemo.
there are some people who just truly believe in the body, and let's face it, the body's miraculous, and it does do
It
things
is.
that and it heals itself and rejuvenates itself when we stop doing certain things and treating our bodies a certain way and feeding it better. But then there are cases where modern medicine is there for a reason,
Mhm.
and it has, for instance, antibiotics. I always think about antibiotics
Yeah.
because I probably would have been dead, 10 times over had I not taken penicillin as a child, or if I've not was not given antibiotics at certain times in my life from strep throat or kidney infections or whatever I have had in my life. And I think that goes for almost everyone. So
Yeah.
at some time, at some point in life, I mean, there are reasons to listen to Western medicine, or and you have to, if what you're doing isn't working, then sometimes you have to, or you
I
just trust doctors. You went
yeah,
ahead and went down the rabbit
yeah,
hole, and you
yeah,
really did your
yeah,
advocated for yourself. And some people don't
yeah.
do that. They just go, oh,
I,
the doctor said this, and so.
you have to advocate for yourself because if
Mhm.
you don't, for example, I even like during chemo, I did a lot of gut repairing even after, and I still do because a lot of disease, like you brought up antibiotics, and then and I research and I like health and I'm so into it. In my next lifetime, I'd love to be a doctor, some kind of doctor. I love it so much. But they say that the gut is the intro, or if your gut's off, it's causing disease. And as a child, as children, we were given antibiotics as normal. I took so many antibiotics, but what I'm reading that since then it's just not the gut is the gateway to disease. So after chemo, I made sure I repaired and like gave my gut good flora reparation, like just preparation of goodness after chemo. And I still try to do that. Like every morning I wake up, my first thing is a glass of water and my pre and probiotic with vitamin Bs right in the morning. Then I wait 20 minutes, take my greens. That's what I start my day. My gut is everything.
We've covered like how this all sort of came about, but what you've done now since having cancer, since going through that journey, and you've taken that and you embarked on a healing, beautiful journey to help other people who have also had breast cancer. How did that come about? And tell everybody what it is you do.
I will. So what's crazy, listening to your path, or listening to God, I'll say, our creator, your creator, whoever he is. A year before I got diagnosed with breast cancer, I wanted to do areola restoration. So that's what I do. I do 3D paramedical nipple tattooing. And I wanted to do it a year before. So it's almost like creators
Why?
like,
Why
here
did
you
you want to
go.
do it? Are you an were you
I was a makeup artist for 19 years and an instructor. So I just wanted to pivot, and I wanted to work and give back purposely, not saying that makeup doesn't. I still do some makeup jobs here and there, campaigns, but I wanted to do it. Read this article, this guy named Vinny in rural America that did it. I'm like, I want to do that. And then I got breast cancer.
wow.
Yeah, that's how it started.
To th- that's that's
It's
really
really crazy. Yeah.
serendipitous, isn't it? I mean,
Very, very.
to think that you wanted to do that prior to getting
Mhm.
breast cancer and that you would had already been learning about that and
Yeah.
wow.
I read the article and then I'm like, I want to do that. And as soon as I was able to use my fingers, because you get neuropathy, chemo, like you can't feel your tips of your fingers, the nerves. I spoke, so I have my business partner who was my student at Artists Within 2007, who has been affected by cancer, not breast cancer, but her own kind of things. We got together and we are the Nipple Sisters, and we created our company. We work side by side and we do clinical days. I also do aerial illustration alone, but we do clinical days back to back. And we have a whole system where we work on breast cancer warriors together. And we've created our own company called Skins Official. And we have different, I'll show you these, these transparent nipple cards hand drawn by us in 5
Oh
different
my
colors. So I'll
gosh.
show Brooke when she gets on here. So basically it's dark to light, 5 shades, so they can see visually what nipple could look like. And we also have notorious, these are called notorious NIPs. So like Big Papa is right here.
Big oh my
Yeah.
gosh, those are
And then we have the
incredible.
real skin shady right here, some shady. So we can even switch the colors like this, and you can like kind of see a little bit of pink in this one. It gives a visual tool, bridging tool for our warriors to see what nipple shape and color they want. It doesn't have to be exactly like this, but it's like, oh my God. So when you put it up against them, they're like, yes, let's do it. So that's what the
Wow.
tools we use. And that's the notorious NIPs. And we have the stickies. So for Brooke, I can even send her a sample bag of the stickies where she can wear the nipples for a week and then
That is
decide.
so awesome. Like,
Yeah,
here's the thing about it is like I said earlier, a lot of people don't realize that when you get a double mastectomy, when women have their breast tissue taken out, that they also
mhm,
have to remove the nipples. I don't
yeah.
think most people
Mhm.
realize that. So again, what did they used to do? I guess they didn't have them before people like you came along
Yeah.
that were able to, it's a tattoo, is it not? It's
Yes. So Mary, in the doctor's office, the nurse or even the doctor would do just a dot, like a bingo dabber, one color, round circle dot of pink. That's it. No details, no nipples. So you wouldn't have the details like you have on this
because
card.
that looks real.
Yeah. These are hand drawn. Yeah.
Now, do you get the raised part of the nipple too? How do you make that?
So we created all hand drawn, free drawn. So everybody has a custom nipple. The color we mix the colors. Some warriors bring a picture of their nipple, but most don't. Like Brooke, she wants her nipples to look the same. You know, that you can kind of watch and look. They bring the
Yeah.
picture. Sometimes they just say, do your thing, do your magic. I want them, but we create symmetry, but we make it look 3D. That's why it's so beautiful. So in the doctor's offices, it wasn't like that. It's crazy. They're walking around with, I do a lot of work on top of those old school nipples. The doctor would actually use the Scotch tape as a measurement and circle around it and just do the color, one color. It didn't last long. It was just a round circle, like a circle of
Because you
pink.
have to get all the little dots. Like you
Yeah,
gotta get the
the
little milk duds.
details. Yeah, you're using different
Yeah.
tools, pigments, needles. It's drawing, making sure it looks fluffy, not like a pepperoni. It's a lot
And
of
how
work.
long does it take you from
So
the
if it's by
comes in?
myself, an hour and a half. If it's Casey and I, literally consultation and all, they're out in an hour. It's
What?
yeah, because it's two people. We have like a system down.
So one does one and one does the other?
And then we switch over. She's a lefty, I'm a righty. We create it, and then and it looks so natural because we're two different styles, but we switch over and we both work and they look amazing.
So how long ago did you start this?
I started as soon as I could take the course, 2018. We started doing this together. We said let's trademark Nipple Sisters and do this, and just been going hard. The only thing I don't know if it's covered. You're in BC, Mary, right?
Yeah.
So it's not covered in Alberta. So it's very frustrating. So we get angel donors, or we create helping hearts, these little black heart tattoos. So for those that can't afford it, we create some kind of fund so they can get it or get a discount.
And just to kind of further that comment that it's not covered in Alberta. I'm just curious as to why it's not covered and and shouldn't it be covered?
Yes, it's
Like, isn't the
elective.
nipple important in
It's
breast
exactly.
reconstruction?
Someone said, yeah, we're getting our breast amputated. And so I remember breast cancer warriors said, if it was a man and he was getting his amputated, how would he feel? She wrote this whole article on it. She had a vlog, and I'm like, I never thought of it that way. But she was saying, the nipple is important for women. It's for us. It's not for just someone. It's visually, as a woman under our clothes. It makes us feel like a woman, like whole.
Well, even just by yourself, if you're in the
Yes,
mirror and you don't
yes,
have a nipple, you'd feel like less of a, I don't know, like feminine, or you'd feel like, why
totally.
why don't I have you'd feel, I guess
It's like
even
a
men
violation.
have nipples. So
Yeah, it's a
it,
violation.
yeah, it would make you feel so less whole
Yeah,
to
it
not
does.
to
So,
have them there.
and I was super scared. And, the first thing, to be vain, women, and I know a lot of breast cancer warriors, you don't want to lose your hair. It's like crazy what it does to you, but I'm happy I did. I'm literally happy I got stripped of everything. It really shifted my look on life. It's given me more than anything else has given me, to be honest.
Well,
It
it's interesting with before Brooke comes on, she's lost all her hair, her eyebrows, her eyelashes, her
yeah.
hair, all of it is gone. She's wearing, I don't know what wig she'll have on
Yeah.
today, but
Yeah.
she's certainly been she's been a walking advertisement for a couple of wig companies right
Amazing.
now. And
Looks great.
she's, yeah, so she's taking advantage of that. But, you know, that in itself makes you feel, uh, she said she just feels like a clown. She feels like
Oh,
a clown.
yeah.
She does the best that she can. She says, it's one thing to lose your hair, but to lose your eyelashes and your eyebrows too.
Yes. And
Um,
I was such a brow freak. So when I was losing my lashes and my brows, I'm like, oh, so I have my brows. These are softly tattooed. I have hair, but I had the thickest Italian brows. I got them tattooed, paramedical makeup, because just softly, I didn't want it to look painted on, but it's a thing. So
well, I'm so happy that we were talking about this and that I have you on the podcast
yeah,
because I want women to understand. I want everyone to understand what the breast cancer patients go through, and the fact that someone like you is there to make someone feel completed and whole after they've had gone through all of this devastating journey. um, because I don't, like I've said 3 times now, I just don't think people understand that the nipples usually taken off.
why shouldn't it be part of the oncology when it's literally what you're just gonna just do the breast and leave it with no nipple? It's not, it's unfinished.
Well, Brooke has just come into the,
Okay.
I see that I'm going to admit her.
Okay.
And I want her to tell you the story about wearing this garbage. She was wearing, she took a garbage, what do you call it, bag, a big green garbage bag, and she would not look after she had the expanders put in. She wouldn't look for a long time. She would go in the shower with that on because she didn't want to see herself without the nipples.
Yeah. Yeah.
So here she comes. I'm going to admit her in.
Good.
Okay, Carmelina, Brooke, Carmelina.
Hi,
Hello,
Brooke. Nice to meet
Hi.
you.
So nice to meet you as well.
Hi,
So
warrior. Hi, beautiful warrior.
I know. Well, it is. It's a war.
It's a war.
It's a war.
You're a soldier,
It's
warrior. You got
it's a
this.
thing. It's a thing.
It is a
You got
thing. So, Brooke, we've been talking a lot about you. I've interjected in our conversation a lot about what you've been going through.
Yeah.
Oh, I don't know. Now that I see it.
No.
You're a great friend, Mary. I want to say you're such a great friend. Like
Next.
the
It's been a
support you're
lot
giving,
for her.
the support you're giving, Brooke. I just want to tell you that a lot of people, like, not, I had my close friends, but that's what we need because we already feel, I already felt like alone. So you're an amazing friend.
Oh,
So
thank you.
Absolutely.
Yeah.
Yeah. 100%.
Uh,
She flew up here and she was here for surgery. She let me cry. She let me complain. She let me whine. She let me worry. She just let me do all the things. So
but it's just been really, as you know, now Carmelina's been through very much a lot of what you've gone through, chemo. She's
yeah.
been through radiation. She didn't have the double mastectomy. She's had lumpectomy, but she was stage 3. It did
Oh,
things
wow.
a little bit differently than you.
Yeah. You really just find out that you don't get to pick a lot of what you want to do during this process. You're kind of told what you're going to do.
it's a gift of surrender, which
Yeah.
I'm good at surrendering in my life.
No, and if you're type A or OCD or a control freak, this is a very hard process to be in. And you're right, let go. You have to let go of everything.
Mhm.
Everything from even just getting up in the morning, getting your son ready for school, or like certain normal things you actually sometimes can't even do out of your
Yeah.
control.
Yeah.
Yeah. I was
Yeah.
telling her, Brooke, about because what Carmelina does is she started to want to do areola,
Yeah.
nipple, artistry and tattooing. What do you call it? Medical,
Paramedical tattooing.
paramedical tattooing prior to her getting breast cancer.
Oh, wow.
She
Okay.
was already interested in doing
Oh,
it. Then
that's,
it's incredible. She
yeah,
started doing this and realizing that, that it's so, I think one of the most difficult things for you, I was telling her your green garbage bag story, your because I
Mary, it wasn't green, it was black because that's way more chic. That's way more
okay, it
chic.
was black. Okay, it was a
I love
black
it.
garbage bag, but she would cut it off like a cape and she
Yeah.
put
Yeah.
2 C's
Yeah.
like Chanel logo on it.
I love
Yeah.
But she wouldn't look
I
because
wouldn't look. No.
yeah,
No.
But that's very common because a lot of the women for the areola restoration, the nipples, they want to jump out of the shower because they have no nipples. They don't want to look. So as soon as they got nipples, they're like, oh my God.
Yeah.
So yeah,
It's a major
it's
part of your womanhood, right? Like,
yeah, major. It's more than, it's not even about who's seeing it. It's for us, it's for you.
yeah,
Yeah.
absolutely. Yeah. And
Yeah.
then adding a partner or a husband into her, whoever it is,
Yeah.
that's
Yeah.
another layer of insecurity.
Totally.
Yeah.
A couple of my warriors didn't even let their husbands see them for such a long time.
I was like that for quite a
Yeah.
while.
Yeah. Yeah.
So it's not easy, and I get that. So yeah, my husband was like, I have no problem, it's fine, but you do feel like they're gonna look at you differently, or you're
Yeah.
not be attractive anymore. And
Yeah.
and it's
I
just
have
not
a-
normal to look in the mirror and not,
No.
whether you're a male or a female, to look in the
No.
mirror and not have nipples because we just
Yeah.
have since we were born, right?
Yeah.
So to not have that makes you feel, I
Yeah,
mean, like you always say, like a clown, you feel like a clown, but
I do.
I have a question. I
Yeah.
know Mary and I spoke about it. I wanted to say, if there's anything that you need, that you feel like you need to work on healed emotionally,
Emotionally.
do you know, can you pinpoint what it is? You don't have to tell me, but kind of go there.
Gosh, how much time do we have?
I know. That's what I'm saying. That
Yeah.
wanted to drop that for you. Just think about it. You don't have to say anything today.
Yeah.
Well, I think too, Brooke, what she and I were talking about is a lot of times, you know, when things like this happen, and I know you and I talked about it, you're like, why did I get this? What did I do? Was it
Yes.
something that I took or ate, or, you know,
Yeah.
what possibly could have done it? And then we talked
Yeah.
about stress levels. And I know
Yeah.
you so well. And one of your major issues is your anxiety, and things can stress. And I think,
Yeah.
I do think you've changed since
I
the
feel
diagnosis.
Yeah, I do feel like I have changed. And I almost feel like I've heard people say, like, oh, you kind of enter a, like, I don't know if I can swear on here, like
You can
You can
swear.
swear.
zero fucks given, you know, you kind of just go into a, like, nothing else really matters and all the small things. You're not going to let people get away with stuff and you choose certain things. But I already have noticed I'm like that. My husband goes, whoa, you woke up and you chose spiciness today. Like, you know, there's certain things that before maybe I wouldn't have said to somebody or been like, or I would have cut off. Now I do. But anxiety, yeah, that's been a major, major thing for my entire life. So the two things I was always stressed about were getting sick, dying, getting cancer, having my dad die. And I had all of those things essentially not die, but my dad died all within 2 years. And I
Yeah.
go, did I literally manifest my own worst nightmare?
I was gonna say, the reason I'm saying this, I feel like you're at the beginning of it, and you know what? I don't know you, but for you to say that, it's happening. The light's coming. Like, you're already shifting, and I don't know you. I already heard it.
Yeah.
Just listen to you. It's the beginning. There's so much for you to understand. You'll
More
understand
change.
this later, that this was a gift. You're not gonna understand me right now.
I already feel that a little
Okay,
bit. Though.
okay,
I've already
okay.
been seeing,
You
like,
gave me shivers.
Yeah,
You're already there, Brooke. Yeah, okay.
yeah, I do feel positives. I know it sounds insane to
I
say
know,
that there's
I know.
positives out of
Yeah.
cancer, but
Yeah.
you know, there's many things from how I didn't realize I loved my husband. I didn't realize how freaking amazing he is and how supportive he is and how he could really just turn around and do everything. And certain people who ghosted you during cancer and certain friends who really stepped up who you didn't think would step up.
Yeah.
And there's been many things.
Yeah.
So maybe Carmelina, you can tell Brooke, because I believe, is it tomorrow you start radiation?
I do. I start radiation tomorrow at 12:30.
What
Okay, well,
can she
radiation was,
expect from that
oh
as a
yeah, the
person who's
radiation
done
was
it?
the easiest thing out of all of
Radiation.
it.
Okay, good. Okay, good. Yeah, I was like, you know, with chemo, I would just wear like the jogging
Yeah.
pants and a toque
Yeah,
and a
no.
vest. But I'm thinking I might go in like a gown tomorrow.
No, no, Brooke, honestly, I did it every day for 30 days, and it was the easiest.
30 days.
Yeah, I had it 5 days a week for a month.
Oh
And
my
the best gift, my girlfriend bought me the parking pass for the hospital. That was the best gift I ever got for
God.
chemo.
She did that. That's adorable.
My girlfriend, yeah, she left it in my things, and I was
That's
bawling.
really cute.
Oh my
But
gosh,
anyway,
that's so good.
yeah,
That's
so because I
cute.
drove
Yeah.
myself, but literally you're gonna be lined up. Did they tattoo you?
They did. Yeah, I know.
Oh.
I've never had a tattoo in my life. And
Yeah,
here I
those are
didn't
my
get to
first
pick.
tattoos. I created stars though after.
Oh, that's a cute
So-
idea.
Yeah, so
I like that.
because so my dad passed away as well. So in
Sorry.
my dad's 1 year, I created stars on the tattoo. Yeah, so maybe you could do that later.
Maybe
too.
I
You're a
steal your
star.
idea.
So then to
Okay.
further, so after she's done with the radiation, then Carmelina has so amazingly generously offered to
Yeah.
help you on your last phase.
Yes, when you're ready and if you can come to fly to my city, Calgary, Casey and I, the Nipple Sisters, will create nipples for you.
Oh my God, are you for real?
Yeah, we'll create.
Let me see those.
So these are just the card with their hand drawn, but these are the bridge. So they're called the notorious NIPs. So you have this is Big Papa. This is Hypnotized. Whoops. I just dropped Juicy. And then we have there we are.
Oh my God.
They're all named after the.
You guys, I'm not making it through this podcast. I started it crying, now I'm ending it crying.
So you have areola restoration. You have the Nipple Sisters creating nipples on you when you're ready.
Oh my God. You are unbelievable. You're already helping so many
Thank
people.
you. Thank you.
What you do, people are so
Thank
lucky that they
you.
have people like you.
Thank
Yeah.
you. Casey wanted me
Oh
to
my
tell
God.
you to have a good surgery and all that, and that we'll be here waiting for you with the nipples.
Oh my God, Brooke, it's so amazing. And you know what? Because I was saying to Carmelina, it's like the flower on, like, or we said the bow.
Yeah.
He's the last person that
So,
you should probably would see in your journey, right? To put the
and,
final touches.
and like literally couldn't have been a nicer person. You were so sweet. You were so
Oh,
like
thank you.
cheerful and like, yeah,
Thank you.
you can
It
tell
took a
you're a
lot of
kind person.
darkness to get to the light.
But it's such
But
a
I'm here.
beautiful
Oh my
thing
God.
to
Yeah.
do. And it's like, we don't even, I know, don't probably look at them very, very often to probably really try to figure out what you want and what kind of,
No,
what style you want and what color you
no,
Yeah.
want. But,
no.
um,
Take a picture.
I'm used to picking out handbags, not nipples.
Well,
not
they're,
now.
we offer their custom nipples, like a custom handbag. That's what we say sometimes.
Oh my
So
gosh.
it's your custom bag. So literally, if you want,
Oh,
take a picture of your nipples. So if you want it to be the same color, you have a visual. Some people don't do
okay.
that.
Do you have any pictures of your nipples?
Maybe.
Got them from your husband.
Maybe. I'm sure I could check with my husband.
I just wanted to also mention you have a product line, Carmelina. Or
Yes.
what is that product? I'm curious.
So like I was showing you Skins Official, it's called Skins Official. So what I'd shown you, these were the notorious NIPs cards. So the bridging gap for breast cancer patients to visually see what they can get for a nipple before the process. So doctors and artists have these. And then we have the spray.
Yeah, what does that do, that spray?
Yeah, what
This sprays we use on the areola. It started with areola restoration, but it's basically wound healing. So some, even if like antimicrobial, antifungal, anti-irritant, all this. So it's science-based colloidal silver, an
Oh.
allantoin medicinal ingredient. So when we do areola restorations, we spray them. They go home with the spray, Health Canada approved, because they're covered with the Tegaderm. This is another product of ours, which you've probably seen a lot of these. Our products, so it's a harmonious healing and aftercare that we send them home with. So the Tegaderm and
Amazing.
spray. So when
wow.
we're done the tattoo, the paramedical tattoo, we spray this on there. Don't touch it. Dry around it. Put the Tegaderm on. Our Dr. Skins. It's
Okay.
like a Tegaderm. It's not. It's Dr. Skins. It's our product. Keep it on for 5 days, and you repeat the process. You
Okay.
keep it on for 24 hours and spray it and repeat the process for 5 days.
Oh wow, and you created all of that.
We created it, Casey and I.
Wow.
So this spray is amazing. So I bring it even when I'm on a holiday, tanning, bug bites, scratches, anything.
I was just going to ask you that. What are the
It's
other
for everything.
purposes for
Oh,
it?
it's amazing. I even spray it like when I'm traveling. I'll just spray it because the product. It's amazing. Like the product, it's amazing. So yeah, we've created our own line, Skins Official, Kinns. It's pronounced Skins.
Guys, I just want to say that I am in awe of both of you. And I am so like honored to even be having you both on this podcast. And I'm so
Don't
like,
make me cry again.
no, it is true.
Yeah.
Like you guys are both serious warriors to have gone through what you've gone through
Yeah.
and come out on the other side. And Carmelina to do and to
The
take
help.
it
Yeah,
into, move your journey into something that is so healing and beautiful for other women. And and to offer Brooke,
Unbelievable.
anything. I just am so grateful and honored to have had you on, and I'm just incredibly inspired by everything you guys have said today. And I Brooke, I can't believe how
I know
you
you've been lost
through
for a while.
this.
Yeah.
I don't know.
Very thank you for having me on, because raising awareness and getting this out to as many people as we can, because it's not easy for women. It's really it's a mind fuck, and I'll say that over and over because it is. Brooke, you're going to be going through more of that as time goes.
Yeah.
You can reach out to me anytime, by the way.
I absolutely will
Yeah,
be. Yeah.
please do, because it is. And you know what? It's
You
also
need the help.
yeah, and it's also light. You're going to be shifting. God is your creator. I don't know your religion. God is beside you, and he's giving this to you because he wants to elevate your life.
I love that. I actually feel that. Yeah.
He's elevating your life, and that's smart. That's good that you're feeling it. And
Yeah.
Mary, thank you.
There's a reason.
Yeah, because this is helping, this will raise awareness and help others. And hopefully the Minister of Health will put this in their budget for women to get.
They
That's
absolutely
my
should.
next thing I'm working on. Yeah, I really want that to be
Yes.
changed. There needs to be more awareness around the whole
Yes.
cancer and your
Yes.
density and all the things, but that's a whole other
Totally.
podcasting.
And is there
I agree.
anything that you want to, like, how can people reach you?
So carmelinabaccari.com is my website. And my Instagram handles at Carmelina Baccari. So it's those, I'll give them to you and you can.
And we can put them up for you on the screen. Yeah.
Totally. Yeah.
Yeah, for sure. Well, thank you so much. And we
you.
will connect you guys as soon as those implants get put in.
Yeah, it
Positive
should be March, I think.
Yes, I'm
Yeah.
excited.